The medical system is so complicated for many people to navigate. To those who don't speak English, it's incredibly hard.
I'm a pediatrician, and what we saw during the pandemic was that children and families were experiencing a tremendous amount of unmet needs.
The old model where we identify something early and then refer out wasn't working.
We can all see and feel, even in our own lives, the pitfalls of fractured, fragmented care. The world needs to move towards integration.
One of the things that we're trying to achieve with Team Up is ensuring that there is prompt access to high-quality behavioral health care for children.
Team Up is making a huge difference through building out what it means to provide primary care.
It has been game-changing.
When the foundation was thinking about this idea, we looked at all the doors through which we might be able to meet these children in these families. And the door through the health centers, it was the most probable pathway of reaching the most children and the most families. So that's the door we chose to go through.
I think about what it would have been like at 16. If I was able to just call my PCP's office and say, hey, I'm struggling with anxiety right now. And they were like, no problem, we'll get Suze over here. You guys can talk about it. Would that reduce the stigma if it was that accessible? If everyone was like, yeah, of course, I talk to my social worker, my PCPs, why don't you?
We have to look beyond traditionally trained psychotherapists, psychologists, psychiatrists, towards who are already existing role models in communities. The community health worker role that is part of the Team Up model is a really good example.
The Team Up model does a nice job in bringing the behavioral health side of things with the medical side of things, with the inclusion of the behavioral health clinicians and the community health workers, particularly for the marginalized, high-risk population.
We try to address possible mistrust in the medical field by incorporating a lot of the community in their own care. So when they come to the clinic, usually the first people they see are people who look like them, who speak their language.
Parents, right? They believe if something's wrong with my kid, what did I do wrong? So it's more of like empowering parents. It's like, it's nothing that you did wrong or not. That's something that they are going through on their own, and let me provide you the resources that you need.
They don't know what autism is, and for a lot of families, they don't necessarily believe in depression or anxiety. And so part of your algorithm has to incorporate that sense of teaching, even though we face hard diagnoses like depression or anxiety in kids that are young as 10, 11. We also have the experience of seeing the interventions work.
Team Up has really been a wonderful platform, not only to directly change the experience of patients and families in Team Up Health Centers, but also through the learning that has happened through this initiative to work on changing at the policy level our expectations for how we would like our healthcare system to function for all of us.
Team Up is an example of the very best use of philanthropy. Going forward, there is an opportunity to continue to spread Team Up. The policy environment in Massachusetts and increasingly in other parts of the country are really looking for these sorts of comprehensive models.
I would hope that Team Up is such an established part of how we think about behavioral health care that it's taken as a standard way that we approach ensuring that we're delivering the care that children and families need.